I'm going to give you a phrase that pays right now, and that is you got to shock the system, right? You can always send out a mailer or put up a poster, but what happens is you do a lot of these and it becomes wallpaper. When you do communicate, try to attach it to, say, a natural a national observance. So it's Mental Health Awareness Week or Diabetes Awareness or Breast Cancer Awareness, whatever it is. Try to utilize what's out there in the media so then you can kind of tag on to that.
Hello, and welcome to the Mental Health Advantage podcast, where we explore how leaders are shaping the future of workplace mental health. I'm your host, Stephen Sokoler, founder and CEO of Journey, and today I'm excited to be joined by Joe Toniolo, Senior Director of Health and Welfare Plans at US Foods. Joe's done incredible work at US Foods to extend mental health support beyond employees to families and loved ones. Joe's featured in my upcoming book for the incredible work that US Foods has done to extend mental health support beyond employees to families and loved ones. And today we'll talk about how supporting an employee's community can really make a difference, not just for that person, but also in the workplace. And I'm Stephen Sokoler, your host, founder and CEO of Journey. Joe, welcome.
Oh, thanks. It's a pleasure and pretty excited to be doing this.
How are you doing today? It must be cold up there.
It is. I was just looking. I'll be running to the office right now. I think it's about 10 degrees, so
Okay.
typical Chicago weather at this time of the year.
If it makes you feel any better, it's 10 degrees here in New York also. So
I was just in Connecticut, and I thought I was going to leave the snow for something better, but it's just colder. That's all.
All right. Well, let's jump in. So before we start talking about US Foods, let's talk about you. So can you tell us a little bit about your background?
Sure. Yeah. So as you mentioned, I lead the health and welfare team at US Foods now for the past 18, almost 19 years. Prior to that, I spent 21 years over at Sears in a similar capacity.
Nice. And what first inspired you to get into HR and well-being?
Well, I'm a finance major, and so I did, a lot of audits, and it's just part of the program in the finance arena at Sears was you had to go through each aspect of the business. And when I hit the HR aspect, I thought, God, this is really cool stuff, right? I could deal with people and not numbers, right? And so 3 years later, then an opportunity came up and I said, yeah, let's do it.
I love that. And now I'm wondering, now 30 plus years later or 25 years later, if you're still, or more, if you're still wondering if, or still thinking that people are easier than numbers. Sometimes I wonder.
Yeah, it's the soft. That used to be a commercial at Sears, the softer side of Sears. And I like the softer side of business, and that's people.
I love that. All right. Yeah. So let's talk about US Foods. So can you tell us what caused you or what inspired you to focus on mental health programs that go beyond simply the employee to include families and other loved ones?
Yeah, we all have, I hope we all have, an EAP, an employee assistance program, and that's for everybody, right? And of course, our medical benefits provide mental health, substance abuse type coverage. And you got to meet the government requirements now. There's a lot of things that are pushed upon employers that you have to cover and do. And so I always thought, mental health, substance abuse, that's a disease, right? That's no different than diabetes or heart disease. You got to look at it as, as itself and try to treat it that way. And so I just want to make sure that our folks, our participants, our employees have options, have alternatives, and how to be treated, right? And you could always do it the traditional way and go see your doctor, go see a therapist, et cetera. But I want to provide options, and that's kind of how I view a lot of our programs.
That's great. And I'm sure you're helping quite a lot of people, both personally and professionally. What can you tell us about those programs? What do you currently have in place?
We have a lot of programs in place. So we call them point solutions, right? Or digital solutions. And I tell you what, I've learned this. each type of disease state, again, I mentioned diabetes or heart or weight, right? And that's another, obesity is a big thing today. There's a mental health aspect to each of those. And so, whatever you're rolling out, you really need to make sure that there's some angle or some help as people start down that journey of cancer or of diabetes. What it's more than just just, yeah, people may have some substance abuse. There's always an angle to, or a mental health angle to, your disease stage. Yeah, I have a bad back. I've been dealing with painkiller. You need to make sure you focus in on that, and that your solutions address the mental health aspect.
Yeah, I love that. And I would assume that similar to most big companies, you have quite a lot of benefits available for employees. Can you tell us some of the programs that you're really excited about or are really working well for you at the moment?
Yeah, I mean, outside of mental health, you're talking about, or just in general, or?
In general, yeah.
Yeah. Yeah. So, we're very traditional from, your medical, dental, vision. I think what separates us from most employers are these digital solutions, right? And so we started our journey back in 2017, uh, with diabetes, and we rolled out a diabetes management program, and then we later uh, introduced another company that was diabetes reversal, and then our industry, we move product, right? Food product. So we're moving 40,000 pounds of goods each and every day. So a lot of MSK thing. So we had to have an MSK solution. And then we started, getting into the mental health aspect with sleep, stress, anxiety, and then cancer, into, skin cancer screenings, virtual, and just getting people excited about taking care of themselves. So we probably did 12 to 15 of these in about 5 years. It's crazy.
Wow.
But that, I think, separates us from some of the other companies out there.
And what feedback have you received from employees and their families about the resources you're providing?
The interesting thing is we are, we're about 80% males. It's just the nature of our business. And I'm told, I don't know if this is true, Stephen. You could tell me this. Well, we don't pay very good attention. And
Sorry,
so our
sorry, what'd you say?
exactly.
Yeah,
Right. And so, we've had traditional wellness programs, a wellness coach. They called me. I refused to answer the phone, and I own the program. And so what I found out, though, is in our culture, or in our, yeah, within our company, and that's really important. We could talk more about culture, company culture, but our folks didn't engage unless they really needed something. So I have a bad back, I need to engage, but they're not going to engage in a wellness program. And so all of a sudden, no engagement in wellness stuff, and now I got 700 people enrolled in an MSK program, and another 1,000 people going through weight loss. It's like, what is going on here? So I had to learn how our folks thought and acted, and when they wanted to engage. And so it taught me I better be ready for when they're ready. Because if I'm not, I have another problem. And to your question, we receive lots of testimonials on the various programs that we have, and that bring you to tears in some cases. Where, there's one person who was a diabetes reversal program, and he lost like 50, 60 pounds. And it's a keto diet, basically. And what brought me to tears is, he when he was on his honeymoon, he couldn't walk up the stairs of Duomo or whatever it was in Italy. And now that he lost his 60 pounds, he's going back, and they're going to walk up those stairs. And it's like, that's why I come into work each and every day, is for stories like that.
I love that. I love that. I mean,
Yeah.
as I lost 85 pounds, and this was a long time ago.
Yeah. Yeah.
But the difference between being heavy and being thin or fit, I mean, it makes such a difference in terms of the everyday things you could do, even just walking around, right? Your knees, your back, you mentioned. So these programs can have a huge impact. And I know for me
Yeah.
personally, hearing the testimonials, like looking at the numbers are obviously very important, going back to, the conversation we were having earlier. But hearing those stories really, really move you.
It's part of the communication strategy is it's one thing to send out the mailers and the texts and whatnot, but when you hear your very own folks talk about the success and the excitement and being able to live again, you can pick up your child or you can throw the ball to them. This is all part and even back to, yeah, that might have been a back issue, but you've been dealing with the stress and anxiety and now you don't have that anymore and you're just your life you've opened up a whole new part of your life, and that's refreshing, right? This is what employers want, is just happy employees.
I love that. You touched on having a heavily male population and how we men sometimes don't pay such great attention.
That's right.
What have you done to drive engagement? What's worked and what hasn't?
Yeah, there's a lots of things you can do, and maybe we'll talk about this later. But I'm gonna give you a phrase that pays right now, and that is you gotta shock the system, right? You can always send out a mailer or put up a poster, but what happens is you do a lot of these, and it becomes wallpaper.
Mhm.
And so get information to the home, right? And so then at least you can discuss with your spouse or your partner. That's one way. Certainly do the texts and the emails. We're in a virtual world. I get it. You also have to engage your HR folks. So we always let our HR folks know ahead of time what's coming out so that they can be kind of the ambassador. So when somebody comes to them, they can at least do some air traffic controlling. And then through our medical provider, we have a health advocate. So if you happen to call the medical and by the way, all of the companies are partners in our ecosystem. There's another little phrase that pays, the ecosystem, right? We want them to refer to each other when you do communicate. Try to attach it to, say, a natural observant, a national observance. So it's Mental Health Awareness Week, or Diabetes Awareness, or Breast Cancer Awareness, whatever it is. Try to utilize what's out there in the media, so then you can kind of tag on to that. The other thing too, I would say to the employers out there, try to combine your communications. For instance, go get your reminder of getting your eyes checked, but within that same email or text, whatever it is, say that get your eyes checked, and oh, by the way, if you have diabetes, we have these programs for you. So it now makes sense, it resonates. And back to the whole thing about not paying attention, make it so simple, like 3 bullets. If it's more than 3 bullets, they're not reading. And I'm the same way. If you send me a paragraph, I'm not reading the darn thing. So keep it simple. Shock the system.
I love that. Shock and awe.
Yeah.
Yeah, I mean, for us, we really like the idea of out of the box initiatives. So, to your point, things become wallpaper, right? You just tune it out, right? You get so
You
many
do.
emails, you see so many things. So, how do you come up with really interesting things that are going to captivate people, that are going to really speak to them,
Yeah.
that they're going to see it? And also, for us, we've learned that there's no silver bullet, right? So you can't just do this one thing that worked at XYZ place. It's you have to keep beating that drum consistently so that when people need it at that particular time, oh yeah, I remember that this is available for me or that's available for me.
Yeah. I always use this example if I'm out speaking or talking to folks like you. It's, when was the last time you changed a tire? I may have done it 30 years ago, right? And do I know how to change it? I don't know in these new cars. And so do I need to be aware of how to change a tire? No. But when it happens, I need to know where to go. Right. Or you go, do the Google, do the YouTube, call somebody. And I think you relate that to the same thing. You don't pay attention um, to all these programs, but until you need something for diabetes or mental health or back, you're going to go to your HR person. You're going to call somebody, and they have to be equipped. And I think that's the important thing. So you can't get disappointed. I would be disappointed if I didn't have the program waiting for them. Right. If they don't come, they don't come. I can lead a horse to water. If I don't have the water, there's a problem here.
Yeah.
you know?
Yeah, I love that example. I've never thought of that, the changing the tire one, but I think it's spot on, right? You may not
Yeah,
need to know how to do it, but you need to know, where AAA is, or you need to know,
right.
how to get help when you need it.
Yeah, yeah,
You and I spoke in the past about life stages and transitions, right? At the time, I was a new dad. I guess I still am. My son's 14 months old, so still a new dad.
yeah. Congrats. Yeah.
Thank you, thank you. How has life stages and transitions impacted the way you've built your programs, right? Understanding that you have a very large population and people will be at different stages, the new college grad versus the person who's been there for 40 years. So how does that
Yeah.
factor into what you provide?
Yeah, I think obviously your experiences, and so you go back. I certainly within my own family. When you talk about mental health and stress and anxiety, and that, you witness, and you don't want anybody to ever go through that, and so you keep that experience there, or you hear an HR person talk about somebody who's going through whatever it is, or this person can't get any sleep, or they have out of control diabetes. Uh, and so you try to make sure that um, you got a lot of competing priorities here. Now, number one, you have the CFO telling you what you can and can't spend, and so the pie is so big, and they don't give you two pies. And so you try to make it everybody get a trophy type of thing. And so you use your experiences, you see what the culture is giving you, you see where your spend is, and you try to, low hanging fruit, start with that, and then expand from there, and just be open to change, right? I think US Foods has been a little more progressive. We want to be the leader, not necessarily a fast follower in some cases. In some cases, yes, but you want to keep your eye open to what alternatives are out there, besides just a traditional way of doing things.
Yeah, that makes a lot of sense. So, how's the conversation around mental health changed over the past few years? So, obviously, pre-pandemic, if we're demarcating it, right? You have
Yeah.
pre-pandemic, pandemic, post-pandemic. Talk to me about what that's been like.
Yeah, from a U.S. food standpoint, we have a lot of truck drivers moving the product to our customers. We also have a lot of salespeople, and so a lot of people out in the cars, a lot of second, third shift type people, and so we started down the journey of sleep. This is how I mean we've always had, as I mentioned, the EAP and just traditional things, but we thought we'd partner with our safety folks to make sure that we're offering some type of tools to help people get sleep, and sleep better and perform, at their top when they are working. And then that's kind of the pre-pandemic. Then you get into the COVID time frame, and I think that shined a light. They say they peel back the onion to stigma, whatever you want to call it. um, and so there was a solution that came about around CPT training, and it helped. It's digital, right? If people didn't want to go see a therapist, whatever, watch some videos, and hopefully that would help. And then when the pandemic really hit, you start to see, our kids. Don't forget our kids,
Mhm.
our children, our adolescents, and then your those experiences come in, that I talked about, and it's like, all right, what's out there? And so we did partner with a company for a couple of years. They changed direction. They went to more brick and mortar versus virtual. And so, but we launched that in the middle, or just at the end of the pandemic, because it's so important now. Folks, I think it's okay to say I'm stressed, right? We even did surveys, and our folks said, yeah, we're stressed. I'm sure we're always going to be stressed, before pandemic, during, after. It's different kind of stress, but it's okay. And we, again, back to leading that horse forward, we need to have whatever programs we can put in front of them, because now they're saying, I'm ready. I'm okay to say I need something. And so if you don't have it, you're gonna miss the boat. So yeah, I think the pandemic, if there's anything that came out of that, is that it opened uh, everybody's eyes to that there's stress and anxiety out there, and let's address it for what it is. It's not a bad thing to say that.
Yeah, absolutely. It definitely did, reduce stigma, people talking about it more. And although obviously I think none of us would want the pandemic, that is one of the few silver linings, right? Is
Right.
more acceptance around mental health. So let's look ahead. New administration here in the U.S.,
Yeah.
AI, lots of stuff happening. Any trends or innovations in mental health that you're particularly excited about, inspired by, curious about as you look ahead?
There's really no magic bullet. Just got to make sure that I have that bullet right for them. Our vendors keep reinventing themselves. That's what I want. Our partners, I call them vendors, our partners. How do they make it easier? That's the key for us. Our culture. I mentioned culture. Remove hurdles,
Hmm.
right? Let's make it easy. And that was one of our taglines at one time: great food made easy. I like to say great benefits made easy. And so and that's the challenge I give to my partners, is make it easier, right? To uh, log in, don't have to go through a whole lot of rigmarole. So getting people to those resources as quickly as possible, giving them maybe an advocate that can help navigate to the through our ecosystem. One of the things that we did, as it relates to cancer, we brought together all of our cancer providers and did like a summit, and saying, okay, how can we make it easier to navigate to the best of the best? I think that's something that I may be wanting to do on the mental health. Getting all of these providers and partners together. Let's talk about. Let's come and say, okay, how can we make our ecosystem even better to navigate and easier to navigate? So,
Yeah, and there's
yeah,
there's a lot of people doing great work in the space. And you touched on obviously the importance of an employee assistance program, but then there's folks who are specializing in adolescent care or taking care of older parents, or for different demographic groups, right? How do we take care of all employees, all people, and their unique needs?
yeah.
So, what advice would you give to HR leaders looking to expand mental health support to include employees, families, and loved ones?
Yeah, I think what happens is, and I talk to a lot of my partners or employer counterparts, and a lot of them get so embedded with the data, and this is one that's so hard. We know it's there. We see surveys and all that, but I think you spend so much time with the data that you kind of lose focus on what you're doing about it. And they're trying to prove it, and back to the CFO and all that. You got to do something, right? And there's a balance. I get it, and so I would say be open to non-traditional ways of, because everybody's different, how they communicate, how they want to be communicated to, how they want to engage. Do they want to take off of work? They need the money, and so how do you make it easy? So I think my suggestion is do something, right? um how make them pay attention, obviously, and how you communicate, but it's the programs, making sure you have something available when they're ready. And I know I said that before, and you, they just focus so much on the data that sometimes it gets in the way of doing something.
Yeah, yeah, for sure. Well, Joe, I appreciate this. Thank you for sharing all of your insights and experience. It's always exciting to learn how great companies like US Foods are leading the way in supporting employees and their families and loved ones. So, thank you for this.
Yeah,
For those of you out
I
there,
look forward to your book coming out.
I'm happy to say First copy arrived last week. It's here. It's real.
All
Yeah,
right.
yours should be coming to you. Coming to
I
you
can't
soon.
wait. Yeah.
Yeah, and thank you for
All
your
right.
contributions to the book as well.
Oh, no worries, man.
All right. If you enjoyed today's episode, be sure to subscribe, rate, leave a review. I'm Stephen. This has been the Mental Health Advantage. Have a beautiful day.